We've been in our private equity platform now for 5 years, and a lot of has happened with 1GI and other private equity platforms in that time, and a lot of things happened in healthcare overall. From my opinion, I think that private equity still is a good thing and really a necessary thing for the doctors. There are so many pressures from the insurance companies, from the hospital systems, from the government, especially on states in the East and West Coast, that really mandate a numeric scale from physicians to band together to have some clout and leverage in the space. And even though that is not really a tangible thing to many of my partners and many doctors, that is very important. And there's a lot of behind the scenes work is happening to really combat these issues that are really against consolidation for physicians and providers. There's a lot of pros and cons to private equity. I think there have been some changes, but I think the changes, for most part, have been behind the scenes. I believe if you ask physicians about their daily practice, they still see the patients on their schedule, their call schedule, their vacation schedule. The hospital coverage really is usually left to the local practices, mandated or controlled by the MSO. So I really think for our daily lives, really not much has changed in our schedule. The changes that have happened, unfortunately, uh, that have not appealed to physicians and caused a lot of angst among providers are not driven by private equity, but have been driven by external factors. There's a lot of the hassle factors that physicians have been complaining about for years, with having to deal with insurance companies to get prior authorization to deal with MIPS, all these things that really interfere with us doing what we want to do, practice with medicine, would have happened and are happening despite consolidation. They would have happened anyway. I really think that private equity overall is a good thing. I'm a staunch believer in it. I think, again, we need to have the consolidation to be able to continue to have a seat at the table when we're dealing with these larger entities that right now yield most of the power.